So thank you for being here. I appreciate you coming out on today's lovely day. And my name is Marla Turnbull, and I'm a National Board Certified Health and Wellness Coach and Certified Dementia Practitioner. And I'm going to speak to you today on achy joints and inflammation. So inflammation is the foundation of all disease, and it's hard not to be inflamed. In fact, I'm here today to tell you that I have inflammation in my knees, and I had a fall this weekend skiing, and I thought to myself, oh, I'm pretty good going into this. And then I fell skiing last weekend. So I talked to Sarah. I said, Sarah, I got this. I'm hobbling along, and I got inflammation. She goes, well, you need to see me later. So I'm going to see her. She's going to hopefully give me some exercises to, strengthen and get a little better. But I'll tell you, when you have inflammation, it's real. Whether it's in your knees, your back, your shoulders, your hips, anywhere in our body. And it's hard not to get away from inflammation today because there's so much with lack of exercise, not eating as well as we should, coming off the holidays. But we're back on course now. Yet not getting enough sleep and stress too will drive up inflammation. So there are some markers in your blood work. If you want me to go over that with you, that you can ask your doctor to measure. One is a HS for high sensitivity CRP, C-reactive protein. When that's elevated, there's high inflammation. So we want to do as much as we can to drive that down. And I have a testimony later in the PowerPoint of a client of mine who is doing amazing. I'll tell you, it wasn't overnight, and she fought me tooth and nail for 2 years to do an anti-inflammatory diet. And I said, it's okay, we're going to take one step at a time. And then all of a sudden, the light bulb went off after her back surgery, her knee surgery, and I think both hip surgeries. Finally, she said, okay, I don't want any more surgeries. And she is in her 70s after multiple surgeries, that anesthesia is not good for the brain. So I said, you're right, you shouldn't have any more. So what are we going to do? She said, I want to do what you're telling me to do, and that's the anti-inflammatory diet. So bless her heart, she started it like around Christmas time. I said, we don't usually do that because it's hard. It's hard around Christmas. But she did. She wanted to. And with 3.5 weeks, I just did the video with her on Monday. And she said she's down 10 pounds. And she feels so much better. Went to the doctor. She doesn't have to have knee surgery. And she's doing great. Now, she's just started, so she's going to keep going. But that video's in here. But just to encourage you, that there is hope.
Marla, do you have to have arthritis to have inflammation?
No. You can have inflammation anywhere in the body. It could be in your stomach. It could be in the brain. That's what we call Alzheimer's, dementia, Parkinson's, when it's in the brain. And you don't have to have it anywhere in the body. But one of the questions I ask is, are your joints achy? Are they stiff? And that's a really good way to, quick way to see if you have inflammation. But most people do have it in their joints. Waking up, well, we'll go through all that. Yeah. So here's what to expect. What is inflammation? How does inflammation affect our joints? And everyday steps to calm down inflammation, eating an anti-inflammatory diet or foods. So adult arthritis, because there is child arthritis also, sadly enough, especially during COVID, 50% of the kids developed diabetes because they were eating junk food, sleeping all day, not exercising. So just talking about adult arthritis, 24% adults in the United States have arthritis. That's 1 in 4. So how many people are in the room? 10, so 11, so we're about 3 people in here, 3 to 4 that have arthritis, if we're looking at a group. That's a lot. It's 54 million people, and then with debilitate, there's arthritis, there's rheumatoid arthritis, which is more debilitating. 8.3% and 19 million people have that. That's just in the United States. So it's a crisis. I'm sure you see it, Jen, don't you? Yeah. Some people, they've lived with it for so long, they don't realize, oh, I'm just getting old, But we don't have to be that way. I'm 60, I'll be 61, and you're 55. We're older. And, we still have aches and pains, but we still should be able to live a good life and be able to move around and lift weights and exercise. Feel good. Inflammation is your body's natural healing response. There's short term, which is acute. That's when it protects and repairs. That's when, it's really kind of off here. That's when you cut your finger, it swells up, gets a little red, and goes away. I'm hoping that's what my knee's doing. Signs of redness, warmth, swelling, and pain. Are you okay? Let's see if I stand over here. It's helpful when it's temporarily, because it's a healing process. So acute versus chronic. So acute is quick, short-term, sprained ankle, cut, infection. Chronic is low-grade, ongoing, smoldering fire. That's when we test with the HSCRP, that chronic inflammation that never goes away. It can be in your joints, your blood vessels, which is called atherosclerosis, when the vessels are inflamed and clogged, and our metabolism and more. How joints work. There's not very good. I'll go like this so you can see. So we have two bones meet. So say our hip, because that's the largest. We have the femur and the whatever sacral coming together and meeting. With the knee, we have the femur and the tibia, and then there's a patella on top. We have the cartilage around it, and that's when you say, doctors will say your cartilage is wearing thin, your bone on bone. We want to protect that cartilage, because that's the cushioning area of the bone. The synovial fluid is the oil, the joint around it. The ligaments, tendons support and movement, like your MCI, whatever joint ligaments, you have tears in those, and then you have to get surgery for that. Healthy joints are smooth, almost silent movement. My ankles are never smooth, they always crack. So I know that I need to add in more collagen. So as I do that, my joints feel better. They're more lubricated as I move around. What inflamed joints feel like? They're stiff, especially in the morning, swelling, puffy, achy, sharp pain with movement, warmth or tenderness, over time, possible wear and tear on the cartilage. So we want to protect those areas as much as we can, especially as we get older. Cartilage goes down, everything goes down as we age, but we can always support that through our diet, movement, PT, lifting weights, getting enough sleep, lowering stress. So causes, wear and tear changes, inflammatory arthritis, which is an immune system driven, old and new injuries, and overuse. Influences are our weight, our activity, stress, sleep, and diet. Does anybody have any questions? Feel free to raise your hand if you need to ask a question. So it's very common as we age, often affects our knees, our hips, hands, spine. Cartilage thins, it's less cushioning. Symptoms are stiff after rest, pain with use, sometimes mild swelling. So in my knee, I fell on my knee, hit my head, So right here I have like a little bump, and right here I have a bump, and here I felt like I am so out of it. So the swelling was pretty significant, and then it went down, but it didn't stay. So I knew if it was going down, it wasn't broken. But the thing I have for Sarah is I can't like put pressure on it and go up on a step. So there's some pain there, which could be cracked, could be whatever. I don't have much swelling anymore. I don't know if it's a bruise, you know, those kind of questions. So time often heals as much as we can. But if you feel, I'll probably have to get an x-ray to make sure. But if you feel there's something that's just not healing after a week or two, definitely get the x-ray. On this knee, I fell on it when I was hiking. This was about 15 years ago, and the pain and swelling, my knee was like this, and it didn't go away. After a week, I went to work. I worked at UPMC, and the doctor there said, you need to get to the emergency room and get it x-rayed. So yes, it was broke, and then 2 days later, I was getting surgery. So if you feel that things aren't going down in a right amount of time, definitely get it looked at. So the thing is, I need to learn how to fall. We need to have some fall prevention.
Were you inside or outside?
I was outside both times. Yeah, I know, right? My poor husband, he's like, oh, here she is again. So inflammatory arthritis is rheumatoid arthritis. The immune system can attack the joint lining, often several joints affected. Prolonged morning stiffness may include fatigue, overall flu-like feeling, needs medical evaluation and monitoring. Often at this stage, they like to give you a medication. Come to me, and we can do all that we can with their diet. And exercise is key, because being in motion is like lotion on the joints. We can do supplementation with herbs and things like that to lower inflammation. Turmeric is good, ginger, onions, garlic, they're all good to lower inflammation. And then if I would say going that route, the natural route first, and then if we still need to add the medication, we work together with that doctor. How do joints get run down? Overuse, strain, old injuries, repetitive motions, heavy loads irritate the joints. Old injuries can become weak links. I'll probably have arthritis in these knees as I get down the road here. Muscles and tendons around the joint can get inflamed. Smart training and recovery are key, and I would say your physical therapist is going to give you the right exercises to keep you going. So it's important, I think everybody needs a physical therapist, because we don't always, we think we know the right movements, but like the gentleman outside, just against the wall and being able to scrunch down the right way. And then somebody said to me, when you get up, just stand up and take 30 seconds or so before you start to move forward. And that helps. When you sit down on a chair, you go to it like this, put your hands, and then lower yourself down. Is that right? Mm-hmm. I'm not a physical therapist, so correct me if I'm wrong. So the contributors: excess weight, more load on the knees, hips, and spine. Sedentary lifestyle equals stiff joints, weak muscles, chronic stress, hormones can raise inflammation as well. Poor sleep, less repair time. When we sleep, our body repairs. So it's really, really important to get really good quality sleep as much as we can. So even taking a nap helps as well. But getting into that deep REM sleep at night is when things start to clean out. Diet patterns influence inflammation levels. Okay, what can influence our lifestyle levers? So what we think, like when we think of a lever, things that help us move, sit, Go forward. Gentle, regular movements. Don't be afraid to move when your joints are a little sore. That helps get them going, helps lubrication go in the joints. More anti-inflammatory foods. Support stress management and sleep, partnering with your healthcare provider. Motion is lotion. When we avoid movement, more stiffness, more pain. So benefits of gentle activity are nourishing the collagen, lubricating the joints, strengthens support muscles. Examples would be walking, tai chi, yoga, exercise with Jen, some water exercise like strength training. Anybody else have anything they want to add that would help? Oftentimes, just when after you eat, I tell people, even if you can't get up and move, because we want to bring in the glucose into the muscles, not in the bloodstream. So when we eat, our glucose goes up. We want it in the muscles. Even if you're sitting in a chair and you're pointing and flexing, working the calf muscle, or sitting in a chair and going up and down to work your calves. That is yeah, I love that. Because the calves pull in the glucose. So if you're pre-diabetic or diabetic, that's going to really drive down the insulin, the glucose levels. So kind of do that for about 15 minutes, especially if you can't get out and walk on days like today. So aim for anti-inflammatory foods. So colorful veggies and fruits, healthy fat oils, no seed oils. So the only oils I use are extra virgin olive oil, avocado oil, and coconut oil. Anything else we can just get rid of. And I grew up in a day where we made frosting for the cakes with Crisco. That was the real thing. And vegetable oil. Yes, it was. It was. And vegetable oil. And my grandparents had a garden, so that we would pick the lettuce and we'd pour bacon grease on it. It was so good. So I grew up in that time where we had to flip the switch because all that is inflammatory right now. Well, we're finding. So concentrate on quality protein, like fish, lean, poultry, chicken, turkey. They're saying now that turkey's better than chicken because what we feed the chickens. Beans and lentils, etc. Whole grains versus refined. So the grains that are in the things that are in the back. Your beans, your nuts, your seeds are all really good grains. The durum wheat. And there's some other things like cassava flour in there. I put in that pulled jackfruit because they're saying that was at Aldi I found last night. They're saying that you could use that. It's a barbecue fruit and you put it instead of pork. So you use it as a substitute. It has high fiber and high protein in it. I'm going to try it later. So reduce our sugary drinks, and that's the hardest thing I think for our age. We grew up with Pepsi and Coke, and I go to talk at groups. I was in Compass talking at the Parkinson's group, and they serve you lunch, which is amazing, but then there's always pop or soda, and I'm like, oh, how do I talk about that when they're drinking pop? And it's everywhere I go. And I said at a conference at AGH to Dr. Licklider, what are you doing? I'm trying to promote healthy diet, anti-inflammatory, and you're giving them pop and soda. He goes, yeah, we got to change that. And I said, yeah, we have to. I worked with a gentleman who drank 6 cans of Mountain Dew a day.
Oh my gosh.
Yeah. And I
Did you
said,
ever sleep?
I don't think so, because there's so much caffeine in that, and sugar, yes. So I said, how can, what can we do in your diet? I never tell you what to do. He said, well, I'll work on adding a smoothie a day and reducing my pop. I said, okay. He really didn't want to be there, I'll tell you. He didn't want to be working with me. And I said, okay, and I'll see you in 2 weeks. Came back, I thought, oh, he's going to tell me bye-bye. You know, I'm done. And he said, I've been adding this smoothie every day, and I'm down to 1 Mountain Dew a day.
Wow.
I feel so good.
Changed his life.
He changed his life, and he went on to work very well with the physical therapist and is doing really well. And he had Parkinson's, so that was a really big step for him. I better keep going. I'll run out of time. So here are some, I'm sorry, Jen, go ahead.
Marla, even the diet sodas
I would say,
are
yeah,
the equivalent, even though they don't have
the
the
sugar,
they have
the artificial
Artificial,
ingredients. Yeah. So anything artificial in our body creates inflammation because our body doesn't know what to do with it. But if we give it whole foods, anything that is not man-made, then our body can do much better with that and lower the inflammation. So some simple swaps: add 1 extra serving of vegetables a day. And I would say if you want to start on something like this, take 1 or 2 things and just implement it for a week or 2 until that gets easy. Then you can add another one. It's called habit stacking. So you do 1 thing for a week, that becomes normal. You add a second one. It can be anything from taking your medications or your supplements to exercise to eating. But just do it, and that's what we do. When we get up, we make our bed, we brush our teeth, we wash our face, and we do it, and we don't think about it every day. And that's what we want to begin to do with some of these things, so that becomes more routine for us. So we can add in water or herbal tea. There's electrolyte drinks, sparkling water, things like that. I know it's not as fun. But after a while, when you get used to them and you go back to the sugary drinks, it's like, oh, wow, what a difference. It's a huge difference in our taste buds. So choose nuts or fruits instead of chips and candy. There are some chips out there that are whole grains, siete chips, and I think Aldi has one that's just potatoes, avocado oil, and sea salt. And so I wouldn't overindulge and eat the whole bag, but you can have a little snack from time to time. Just look at the ingredients. Focus on progress, not perfection. Okay, here's our little video, and I'm hoping...
So welcome, Marion. It's so great having you here today.
Thanks, Marla. Thanks for asking me to be here and be a testimony to the anti-inflammatory diet, how important it is in your life.
Yes, thank you for sharing your journey and your testimony. And we'll get right into your testimony because it is amazing. And I think people need to hear that. So I'll let you take it away and share your journey with us.
Thanks, Marla. And, I appreciate all your encouragement towards this, too. And, as you've known through, my history, I've been told for years that I should follow the anti-inflammatory diet. And I think I'm not unlike a lot of other people. I don't think that's really going to matter much, so I really didn't pay attention until, so much of the arthritis got through my body so badly that I needed a back fusion because the arthritis was so bad through my spine, and then it went to my hips, so I had to have hips replaced, and then it was going to my knee, and I needed to have a knee replaced, and after 3 surgeries, I've told you many times, my body just can't take anymore. So I looked for alternatives, and I asked a couple specialists, along with yourself, what suggestions, and the anti-inflammatory diet kept coming up as a definite no-brainer for me. So instead of fighting it, I just joined forces to really take a look at it and realized how easy it was to do. First of all, was to cut out the seed oils, which so many of us eat and don't even realize we're eating it. And if you do have an inflammatory system, you really should avoid all of that. And just get to the avocados, the olive oil, the coconut oil. They're all very good oils, and they look fine, they taste fine. Stop the synthetic stuff. The processed lunch meat's terrible for you. And start using just common sense and normal food, organic grown food. And then the flour. That was the big thing, was looking at how much you have to read the labels and how much enriched flour is used in almost every processed product that we buy. But once you start to look at the labels, it's not so hard to find the folic acid free. And you can find them at Costco, Sam's Club, even Walmart. We found them. You just have to look for them. And the pastas are very bad too. The American pastas, we have found out, Italy won't even take our flour because it's so processed. But Italian flour is altogether different. And if you try it and really get the whole Italian processed flour in pasta, you notice such a difference in the taste of the food. And it does not bother you. It doesn't, inflame you at all. So since I've really taken this serious, I have no swelling in my hands, no swelling in my ankles, my knees. I went to the orthopedic surgeon. I am going through the niche of the gel shots to prevent the surgery as long as I can. And he said I was doing fine, the swelling was done, and I was very honest with him. I said, I can live with this. I can live with this knee as it is right now without surgery. So he said to continue to do it, and he said it definitely continue on the anti-inflammatory diet. It's the most important thing for this condition.
For you to say that is amazing, because you would never say, I can't live without this shot or this.
No, and I mean, I was looking, I said, please give me the shot. I was looking for it, I have to get the surgery, I'll get it. But the more and more you read, you look for these as much as you can, and it's something this simple. It's like right in front of you.
Yeah.
So, tell any of your patients if you have any of these, the condition that you're, the anti-inflammatory diet is very easy. It's a no-brainer to just start to do in your life.
Yeah, so this toolkit is what was sent to Marion to, I guess, look over and approve, because
Yes.
we get it to you in time, soon enough. But this is something that we'll be handing out, and she looked it over, and it just breaks it down very
Yes, especially the grocery list. It's so much easier to just follow it and know what you need to get. And you're not going to like everything on it, but there's going to be plenty of things that you do like, and fill your diet with that.
Yeah. So is your bloating down?
Yes. Since I've started this, I've lost 10 pounds, and not through any real effort other than just following the anti-inflammatory. Cut down some of the crap from the holidays and stuff that you have. Sugars.
So you started around Christmas time.
Yeah, right before Christmas, actually, for some reason, because everything was swelling so much on me. So. And then I took it real seriously after Christmas.
So that was just over 2 weeks ago.
Yeah, I'd say a little over 3.
Like 3 weeks. It has gone down that quickly. That's pretty amazing.
And Christmas dinner, I prepared anti-inflammatory, and no one knew the difference.
Oh, good.
Even the bread we got, everything, we made sure it was acid-free, or folic acid-free. So.
Great. Oh, that's wonderful. I love your story. Thank you so
Thank you.
much, Marion. Do you have any encouragement to give people that feel like they can't do this?
Oh, just don't be afraid of it. Just look at it. Your toolkit is an excellent way to just look at what you really need to have and realize it's not that difficult to do. You just really need to read labels. And the oil and the processed meat, we all pretty much know that's not really great for you.
Yeah.
So to try to get the more organic, natural, it's you can't find that. You just have to search for it.
And then you said you switched to potato chips that are just.
Yes, we found at Costco. My husband's mainly the chip eater in the family. I'm okay with or without it, but he found one that's just potatoes, potatoes, sea salt, and avocado oil. Just 3 ingredients.
That's
And it
wonderful.
does not bother him at all either. He also needs the anti-inflammatory diet. I think I did say that before. And it's helped his hands and everything as well.
And he's lost weight. How much has?
Yes. Yeah, he's lost 80 pounds since we started this.
Oh, that's amazing. Congratulations.
Thank you.
Yeah.
Losing that has helped, and I'm sure all of your clients you'll realize the difference in the bloating.
Yes. Thank you. Thank you so much, Marion.
You're welcome. Good luck to everybody.
Okay. Thank you. Take care.
You too, Marla.
after the video. Pretty amazing, isn't it? And just taking little steps is all she did. And she was a very difficult client in that if I said something, she would sort of think about it and decide if she wanted to do it. Oftentimes she didn't. That's why it took the 2 years to get her where she is. But she is there now, and that's the exciting part. So there's always hope. There's always hope, and I'm here to cheer you on and help you take those steps. So a little bit about stress, sleep, and pain. Stress can tighten the muscles, increase inflammation signals, make our pain feel louder. Poor sleep, less repair time, we talked about that. So some supportive habits, short breathing breaks. They're so important to get the oxygen flowing through the blood, because every part of the body needs oxygen. So I always ask you, how is your breathing? How are your lungs? I'm doing okay. Take a deep breath. Take a couple deep breaths and get all the oxygen to the brain, and the heart are the most important vital organs that need the oxygen. Gentle stretching, especially at night, because we've been going all day. It calms us and winds us down into a nice routine for sleep. So when to see a medical professional? Sudden severe joint pain or swelling, a joint that is very red, hot, or extremely tender, pus, fever, or feeling very ill, noticeable joint deformity or loss of movement, pain that disrupts sleep or daily life and doesn't get better. There could be autoimmune arthritis or recent injury, like me. So an example of a joint-friendly day would be morning, 5 to 10 minutes when you wake up, of gentle stretching, getting some water in, or walking, and then breakfast with protein and some color. Some water is really important because we've been fasting and not drinking through the night, so our body needs that water to get started. Start with some really nice anti-inflammatory things in our water. Would be lemon, ginger, a little bit of honey if you'd like. Turmeric is good, and get that in. In fact, there's a supplement called X-Flame, and I just started it with my knee. I've never taken it before, but in there is ginger, turmeric, some pepper, alicetin, which is onions and garlic. And I thought, wow, I'm going to take that first thing in the morning. I may not stop because all of that is good for the digestion. It helps clear out any bacteria, viruses, fungus in the gut. Fungus comes from eating too much sugar, like over the holidays, but taking it, I thought, I don't have to prepare that in water now and drink it. I do like lemon, so some lemon water, warm lemon water in the morning is good. So some daytime, you want to stand and move briefly each hour, and I'll tell you I'm the worst at that, because I'll get in my office and I'll just keep working, and I have to remember to get up and walk around. So remember to do that each hour, and hydrate regularly, especially in the winter, we're not as thirsty. So that's when we become dehydrated, and if you have sudden falls, my husband said, are you drinking enough? Are you drinking? Here, drink some more. That could be dehydration. So evening, eat a whole food dinner, 5 to 10 minutes of easy motility work. Screen time, wind down for better sleep. So screen time, TV, phones, computers, tablets. Because that blue light interferes with our sleep. So I mentioned the X-Flame. There are some supplements to support your pain. So I would ask you on a pain scale how to rate your pain if you're in pain. 0 being not at all, 10 being the most severe. So rate your pain. Are you 0 to 10? Oftentimes, like with Tom, I said, tell me how you're feeling when we first met a couple weeks ago. Rate how you're feeling. And so I like to look at that, and then oftentimes at the end or toward the end we'll do it again to see how you're doing, And then oftentimes that's improved by 60 to 80% in my patients. It's pretty amazing. So I took a video of him walking, we did all kinds of things, a heavy metal test, just a questionnaire, and then we're gonna compare that when we get toward the end, see how he's doing. If you're on any blood thinners, I would ask you that. Here's my recommendation if you're not on any blood thinners. That X-Flame comes in capsules or powder. There's a 20% off discount for today's presentation. So there's 120 count. It's regularly $69, 20% off is $55.20. The powder is a little bit different in pricing, but not much. A little cheaper. And that's one scoop equals 2 capsules. We would start out with 1 to 2 capsules and then build up from there. I'll tell you, when my knee was so inflamed, it recommends 4 capsules a day, I think, is the recommended loading dose. So I took 2 at dinner time and 2 like an hour before I went to bed, and I woke up. I had all this heartburn, all this around my heart. I thought, oh my goodness, am I dying? So that was a little too much before bed. So now I just take 1 capsule, but you can get away with 2 or so. I would say let's load up. Let's not start with 4 like I did. And then we have the next one, which is SPM, Specialized Pro-Resolving Mediators, and that is anti-inflammatory, where it also lowers the inflammation. And the other one is vitamin D3 plus K2. Vitamin D is also anti-inflammatory. Who's taking vitamin D? Good, good, good. Make sure you're getting vitamin D with K2 in it as well, because K2 helps the absorption into the bone. We don't want the D not getting into the bone, because our bones are made of D, K2, phosphorus, magnesium, calcium. There's a lot of minerals in our bones, so we want to support all of those minerals to build healthy bones. So D3, K2, because that gets in. And as you're taking it, I recommend more in the winter time, because our D lowers, there's not as much sunshine, and so we don't get that vitamin D in our body. So that is one thing, as well as the B vitamins. The B vitamins go down in the winter time too. So if you're feeling kind of sluggish, I would just up those 2. See how you feel. If you're getting sick, absolutely increase them. Add some vitamin C, some zinc to get you through, and then you can back down. It's not forever, but just to get us through. So working with your body, chronic pain can feel frustrating and discouraging, but shift your mindset from my body is against me to what is my body asking for. So when we're having pain, fatigue, tiredness, waking up, not feeling regenerated, there's something that our body needs. So we want to ask that. Often it's asking for more gentle movement, more real nourishing food, rest, recovery, less constant stress. And don't feel bad if after a really busy week or day you say, oh, I have to really, really just stay in the house and nobody come over, no phone calls, and just kind of rejuvenate again. Our body needs that, especially as we get older. My grandkids came over every single day during the holidays. Finally I said, okay, good, no more sledding, no more, we can relax now. They're back in school. So small, consistent changes add up over time. So just don't be frustrated with yourself. Just set a goal every day. We want to do one more thing, or every week, one more thing. So key takeaways and next step: inflammation is natural, but chronic inflammation can drive joint pain. So achy joints reflect both local changes and whole body influences. You can support your joints by moving regularly, eating more anti-inflammatory, caring for stress and sleep, working with your healthcare provider. Choose one or two more changes to start this week. Thank you for having me. Does anybody have any questions? I would say, if you're not already working with one of the physical therapists here, think about that. Or if you're working with NeuroAccess, continue that. That's really, really important to keep that up. It's easy to say, oh, not today, it's snowing, it's icy, but you're all here, and that tells me how amazing warriors you are. Last year it snowed also on the day I talked, and, and you're here. Most of you were here during that talk, so thank you for being here.
Maybe leave in March or something.
Aw, well, at least I'm close, you know, so less likely for someone to cancel. Any questions that you have? There are foods that we can go over. I kind of made a little mark where the proteins